Welcome everyone to your afternoon education session on funding for ostomy supplies. My name is Misty Stevens and I'm a nurse specialized in wound, ostomy, and continence. So BC funding for supplies if you have an ileoconduit. We do have a list of medical suppliers and pharmacies that has all of the pharmacies within BC, and I believe we have one for the Yukon as well. And these pharmacies are going to stock your ileoconduit supplies and usually your intermittent catheter supplies and your incontinence pads. They will stock those as well. So on that list will also be information on how to contact an NSWOC. Some of these private pharmacies do hire NSWOCs to work in the community and support you in your transitioning or throughout your lifetime with your ostomy. So funding is got lots of options throughout BC. We have BC Fair Pharmacare. We have extended medical benefits such as your Pacific Blue Cross or your Green Shield are just two examples. And sometimes they may cover your catheters as well. Please give them a call and ask them what they cover. Also, some of these extended medical benefits do require a little bit more information, such as a doctor's prescription or a surgical note that tells them that it was a surgically created ostomy. Contacting them before you go in to purchase your supplies is really important because then you know what you need in order to get reimbursed. You will definitely need your receipts, so make sure that you keep those. Your First Nations Health Authority do provide some amount of funding. A lot of times it is actually full funding, but just be aware it takes about 6 weeks in order to get that funding approved. The NSWOC in your area will know that. The First Nations Health Authority takes a little bit of extra time in order to get funding to you. We will help provide you with those ostomy appliances until First Nations funding does come through. Persons with disability also provide some amount of funding, so you will have to contact them to find out how much you will be able to be reimbursed, as well as the same with Veterans Affairs. They will also provide some amount of funding for your ostomy appliances, so make sure you contact them and find out how to be reimbursed by them. Keep all of your receipts for all your ostomy supplies as well as any of your continence or incontinence supplies, such as your continence pads as well as your intermittent catheters. Talk to your accountant and determine if they can be used as a tax write-off on your taxes. A lot of the times, if your expenses exceed $2,000 in a year, that can be a taxable write-off for you if you have the receipts to prove that. So BC Fair Pharmacare is a government program in BC that assists you with all of your medications and your medical supplies that you have for your ostomy. It is something that you do need to apply for. It is not automatically given. It is also something you have to have done your taxes for. So you had to have done your taxes for the last 2 previous years. If you have not done those, I encourage you to make sure that you try and get those done. And then you can call Fair Pharmacare or you can go online and apply. And you only have to apply once in your lifetime, and then you're automatically covered. And that will include your medications as well as your ostomy appliance supplies. If your income has significantly decreased in the last 2 years, because they do go back 2 years, then I would ask and call Fair Pharmacare to relook at your taxes and see if they can get you into a different payment plan. I'm going to give you an example of how Fair Pharmacare coverage works. Let's say you make about $13,000 a year and you're considered low income. Fair Pharmacare will put a deductible in place for you. For an example, if you make about $13,000, sometimes they put a deductible in place that's about $500. Now, they don't expect you to put that $500 out right away. What they will do is they will offer to pay 70% of the cost of your ostomy appliances, and then you will cover 30% until you reach that $500 deductible. And then they will automatically kick in the full 100% coverage plan. Now, this is often done through some of these pharmacies that are on that ostomy supply list. So make sure that you phone the pharmacy beforehand and see if they direct bill to pharmacare, because it will impact how you are dealing with your expenses. The Yukon does have funding for supplies as well. So payment for your ostomy supplies can come from a third party and or private health insurance. They also have a pharmacare, an extended health benefit program that you can get in touch with. Their Veterans Affairs does cover a lot of their supplies. They also have a great program called the Chronic Disease and Disability Benefits Program, and this includes ostomy supplies. Their palliative care program does supply ostomy appliances. Be aware that in BC, our palliative care program does not supply ostomy appliances. This is only in the Yukon. They also have the non-insured health benefits program, and that will help provide. And the disability tax credit is the same for the Yukon as it is for BC. So you can always make sure that you apply for that. Most Yukon communities do not have local pharmacies, so ordering of your ostomy supplies is often done by ordering through pharmacies that are located in Whitehorse area. Yukoners discharged from our hospitals should have enough supplies, and the NSWOC will be aware of this, to last at least 2 weeks until their supplies can come through their pharmacies in the Yukon. The disability tax credit is for ostomy patients that have an ileoconduit or a urostomy. It is a federal tax benefit that you can gain 1 year after the creation of your stoma. This does not apply to Indiana pouch stomas. It only applies to the urostomy or the ileoconduit stomas. You apply through a government program, and it does have 2 different elements to the disability tax credit that you apply for. One is done by your medical doctor, and another part is done by you. And they want you to tell them about your medical history and how this ostomy has changed your life, and the increased time and care that you have to put into your daily living to take care of this ostomy. The disability tax credit can be usually about $7,300. So if you can, make sure that 1 year after your stoma creation, you are applying for this. The form is a T2201 and can be downloaded from the CRA, or there is a QR code here on the screen that you can download that disability tax credit form through. If you forget, and it's 3 years after you've had your stoma created, this is a retroactive disability tax credit. So make sure that you still apply for it. You will get the money back from the date that your stoma was created up to 10 years. They won't go past the 10 years, but you can get money back if you do not remember to do it right away. Thank you everyone for joining our session today. If you would like to participate in any of the modules, please contact our program assistant, Saran Tesfaye.